So I want to talk today about risks associated with sitting down. So a lot of us have jobs at a desk, and obviously normally we would sit down. So when I'm sitting down, a few things are going to happen. I'm probably going to sit down for long periods of time, and it's going to alter how my body actually is. So if you want to look at me from the side, you can see that things change in my legs, okay? So first of all, I want to talk about what happens with our thigh muscles. So these thigh muscles are now shorter now that I'm sat down. So they're going to be shorter, and obviously that leads to tightness. Secondly, the buttock muscles are now lengthened. So what you'll notice here is that they're going to be longer and not active. And also my hamstring muscles, again, they're not active again, okay? The same higher up in my trunk, my abdomen, my ab muscles are more relaxed. So overall, there's a danger that when we sit down, we have that sort of forward-leaning posture where certain muscles get tighter, certain muscles get longer and weaker. And when we take that over years, there's a change. And that really will manifest in an actual change to the pelvis, where as before you would have been more stacked, nice and tall and straight, your body will change. So first of all, your pelvis, you're probably going to get more rounding in the lower back. And you can kind of see here in this spine that we've got, you're probably going to get a more curvature in the lower back. And when that happens, that means your pelvis is going to tilt forward, okay? Now, when that tilts forward, clearly there needs to be a correction higher up, okay? So if I'm tilted like this here, I'm going to have this backwards lean, and I need to correct with my shoulders and my head, creating a forward sort of head position and rounded shoulders. This, obviously, as life goes on and you keep working, comes to a point where you're going to maybe have some back pain, maybe you're going to have other problems like knee pain, it might be neck pain, something will give, okay? So today, I'm going to talk about things you can do to try and get out of having a chair-like posture, chair-shaped posture. So the first one is going to be doing what we call some chin tucks. To try and get my head in a better position, I can do a chin tuck and then an extension. So you can do a chin tuck and an extension. So you can just do 10 of those. You can do those at your desk or whatever you want. Okay, so the first thing is looking sort of at what's happening at your neck. Second thing we can do in terms of stretching would be to try to stretch out the chest. So as our shoulders come forward, our chest gets tighter, okay? So you could try and do this stretch on a door frame or on a wall. Using a wall here, I can use the side of my hand. I'm going to place it like I'm doing a karate chop into the wall higher up, and I'm going to twist my body, stretching my arm out behind me, okay? So I'm trying to stretch, and I'm going to hold this for at least 20 seconds, okay? So the second thing is, after adjusting your neck and head position, you can try and open up your shoulders. Now, there is a really nice stretch you can do when you're seated. It's called a Brugger's stretch. And the idea is you would open up your hands, squeeze your shoulders back and down, and open up your chest. So again, if you're in a chair, the same thing. Sit upright, that's going to switch your abdominal muscles on. Open up your hands and squeeze, okay? Notice my palms are facing forward. Again, you can hold that for 5 seconds, just trying to open everything up. Obviously, we talked about changes lower down. We talked about these thigh muscles getting tighter, but what I didn't talk about was there's a muscle called the psoas major, and that also gets tighter. It attaches to the back and to the femur. So to stretch that out, we're going to do a very simple yet effective stretch, ideally not with a chair with wheels for this one. Let's say, for example, I'm getting more tightness in the left of my back. Often, let's do that side first. So you can put your foot on the chair. You can rest your forearm on your thigh, have your hand down. You're going to hop backwards, and then you're going to lunge forward. At the same time, you're pulling up your pelvis, pulling in your abdominal muscles. And you ideally want to hold this one at least 30 seconds. You could even do a minute to get a really good stretch. Following on from that one, you might actually want to do a stretch of the thigh as well, because that's clearly got tighter. You want to grab the ankle, and if you can hold it with 2 hands. But the aim of this otherwise is to hold on, and you're going to pull your heel to your bottom. Now, a lot of you, if you've not tried this before, you might actually be too tight in the front of your thigh to get your heel to your bottom. So what we need to do in that case, you're going to have to try and get your knee onto the chair, holding, and then you're going to pull that way and hold. Again, 30 to 60 seconds hold. Try and hold your body more straight. You can even use two hands if you've got good balance, and stretch. So again, that's going to help correct your pelvic position. That's going to bring things more flat and allow your body, rather than having the forward steep position, to be more upright. So that's your stretches. The second thing we can work on is some strengthening. So we need to stabilize the pelvis in the right position, okay? So to do that, if you're at your chair at work, you can do some simple things. The first thing would be to try to get your abs a bit more active. So to do that, you can sit more on the edge of the chair. You can put your hands on your knees and try and lift your knees up and push at the same time. So I'm pushing down on my knees and lifting up. Try and have good posture when you do that, and hold for 5 seconds. You could try little abdominal crunches. You probably want to be more on the edge of your chair. You can lean back and just squeeze forward. So again, you're just trying to get your abs a bit more active here. Just doing some forward sit-ups. Obviously, if you want to make it more effective, you do that on the floor. Okay, so we've tried to work the abdominals to draw the pelvis into more of a neutral position. We need to work what we call the posterior chain. So that's the gluteal muscles and the hamstrings. And to do this, you could do a glute bridge, which you can look up online for yourself. But otherwise, if you're at your desk, you can do something called sit backs. So again, with your chair, ideally you want to make sure that if it's got wheels, that it's stable. Okay, so it's wedged somewhere. It's not going to run away from you. And you're going to stand just in front of your chair. And the idea is as if you're going to stick your bottom out and touch and then come back. So try and keep your weight more through your heels. Try not to allow your weight to come forward. You want your weight to be more back through your heels. You're going to come, touch your bottom down on the chair. Ideally just doing 10 or 15 of those. You can do 2 lots of 15 or 3 lots of 10. Would be really nice, just to try and build up the glutes and the back of the legs. You can make that harder by trying to do it on one leg, which is a lot harder. I'm not sure if I'm very good at this one. You've got the chair there for safety and you can come up, but that's actually quite difficult, and I struggled with that myself. So you've got something to progress that. Now also, the side of your hips, you're going to lose muscle on the side of your pelvis as well. So this one would be really helpful in terms of strengthening. Now, I'm going to just stand, put my weight through my left leg. I'm holding on here for support. I'm going to put my hand on my hip and then just lift out. So it's called a hip abduction, okay? So you're going to do a hip abduction. I'm leading more with my right heel, actually, and I can feel the contraction in the side here. I'm trying to keep a good upright posture when I'm doing this, okay? So again, 3 lots of 10 or 2 lots of 15 would be good for that one. And then ultimately, you're going to get weaker in your calves as well. So you can get blood flow as well in this way. So you can just do some heel raises as well. Try and keep things moving. So really they're the basics, what I would say, to try to correct the pelvis, open up the chest, bring the head into a better position. There's lots of other things you could be doing. If you're really struggling, please do make a referral to occupational health. Thank you.